If you're a parent or grandparent of a teen or young adult, you'll want to listen to this. Almost 50% of adolescents aged 13 to 18 live with a mental health condition, but students and adults can learn warning signs and symptoms through a program called Teen Mental Health First Aid. Hello, and welcome to Living Well with Robin Stoloff, empowering you to live a healthier life. Teen mental health challenges are on the rise, but we can make a life saving difference. Here to tell us all about it is Statewide Director of Suicide Prevention and Special Projects, Jamie Angelini. Thank you so much for joining me, and that's of the Mental Health Association in New Jersey. Thank you so much for joining me, Jamie.
Hi, Robin. It's so good to see you. Thanks for having me. And May
I
is Mental Health
appreciate
Month,
it.
so really
Yes,
happy
it
to be here.
is. Oh, we have done these many times before, and I'm always so happy that you can join me because it's such an important issue. I always say our mental health is just as important as our physical health, and we need to talk about it. So let's dive right into it. Why are our teens and young adults experiencing more mental health conditions?
So our teens and young adults are under more stress than ever, I think, not having enough coping strategies and protective factors, but having a lot of risk factors. So we know that, we're seeing a lot of mental health challenges, but there's a lot that we can do about it, and we feel hopeful.
Absolutely. And you're doing that with this program, Teen Mental Health First Aid. Talk to us about that.
Sure. So you are very familiar with adult and youth mental health first aid that has been
Yes, I've
around for
taken
many
it
years. Yes.
myself.
So, Teen Mental Health First Aid, which is overseen by the National Council for Wellbeing, piloted in 2018-19. And then in New Jersey, our agency at the Mental Health Association, we were able to work with schools, high schools in New Jersey, to roll it out. It's designed for ages 15 through 18, grades 10, 11th, or 12th grade. And locally, Aptagami High School was actually one of the pilots in 2022.
Where my kids went to school, I
Yes,
must
I
say. Yes.
know.
Uh-huh.
Since then, there's about 46 high schools in our project, and it's taught by high school staff who are trained as instructors, certified mental health first aid instructors. And it really helps the young people, the teenagers, learn common signs and symptoms. That we talk about suicide, we talk about overdose, the impact of school violence. We also have open conversations around substance use and mental illness, conversations that young people are already having, but now they're structured and we frame them so that they also feel validated, that they're not alone if they are struggling with a mental health challenge. And the most important thing is helping them to learn to trust, to tag in a trusted adult. And that's always the theme. If they recognize signs in themselves or in a friend, getting that trusted adult and creating those circles of support so that they always have someone to go to if they're struggling.
That is so important because many times I think teens are a little bit afraid, whether it's themselves or their friends. They don't want to get someone in trouble
Yep.
for whatever it is if they have some issues with substance use.
Mhm.
And we need to make sure that we tell them that it's safe. You have a safe place to come and that we will be able to help you. And you actually are teaching these kids in the classroom. Their teachers are teaching it because you train the teachers,
Yep.
part of the regular curriculum, how to identify issues of mental health within themselves and within their friends. Talk to us a little more about that.
Yeah, so the curriculum is broken down by 6 weeks. So it's six 45-minute sessions. So the nice thing is it is taught in the classroom. So we work with the schools and they decide where to embed it. And by having instructors who are part of the school staff, it almost becomes the fabric of the school. So that every year, the hope is that they present these mental health trainings. So in that regular class size over those 6 weeks, they present different topics every week. Every session ends with how do we reach out? So young people, students will know how to reach out for community supports, but then also in their school. They may not be aware of how to access mental health services in the school. And we want to make sure that they feel safe and they feel confident. They also do a lot of group work. They get these beautiful manuals. So they work on them and they may look at a vignette of a young person and really think about how would I help if this were my friend? So there's some role plays and activities. It's very interactive, and we've seen great results. The students are they're loving it. They are really excited about
It's amazing that you can provide this free of charge to the schools and you provide all of the tools and resources through a grant. So that I mean, I cannot see why a school wouldn't want to bring this in. The only reason might be that they're not aware of it. So that we're trying to get that message out right now. It is available and it is free of charge. Talk to us about the kids and what they're saying about it and what they get out of it, because I know that you've seen some personal stories.
Yeah, one of the things that, and the students will, give us feedback after they take a pre and a post evaluation to kind of let us know what they've learned, and they're able to give feedback. One of the things a lot of them say is, I wish my parents had this. I want them to know more about mental health so we could talk about it at home. Or they'll write things like, it's okay not to be okay, which is something we always talk about, but they're feeling that, they're understanding that. Or they'll say, you know what, now I know it's okay to talk about suicide openly or to ask a friend. I know I can tag in a trusted adult. I know who my 5 adults are because we do an activity called the Circle of Support where we want them to write down 5 trusted adults so that they always have someone to go to. So the feedback has been really positive. And just the students saying, now I know I can have open conversations, or I have the words and the tools so that if I'm worried about a friend, I know what to say. And that's been really powerful.
You could be saving lives because I believe suicide is the number one cause of death in kids 13 to 18. Is that correct?
So it's the second or third leading,
Second
depending
or
on the
third.
research that you look
Mhm.
at. And sometimes we look at 10 to 24, sometimes we look at 15 to 24, but we know it is a public health crisis. And it's really important that we're having these open conversations with our teenagers and letting them know that if they are struggling or in distress, they can reach out. They can call 988, they can go to their school counselor. We just want them to have a lot of resources available and to not be afraid to come forward. And we know that friends are going to tell friends first. They're going to notice it in each other. They may tell each other. So now, if they have these skills through teen mental health first aid, we feel they're more likely to bring in that trusted adult and have those resources when they're having these conversations.
Do you think the stigma around mental health is dissipating in this generation of students?
I do, and I'm happy to say that. And I say that because when I'm out at the high school, the students are talking about mental health so openly. So I think that we're moving in a really good direction and that these conversations and the narrative is changing. And I think programs like Teen Mental Health First Aid are just going to continue to push it to the forefront, where these are just typical conversations that every student is having in the high schools. And the more students certified, so this is a national certification. So the students are getting a national certification. We always tell them, put this on your college resume, put this on your resume for the workforce. And as they're getting the certification, and more students are taking part, we're changing the narrative. And the hope is that everybody's sharing the same messaging that it's okay to talk about mental health. So yeah, I do think we're moving in a good direction.
While social media, as we know, can be detrimental to these young folks, getting almost addicted to scrolling and comparing themselves to others, in some ways it can be helpful because there are many celebrities and people in the public eye who've talked about mental health conditions and struggles that they have had. So I think in some ways that can be a positive because they see their idols that they think are, above it all, that have everything, still struggling with mental health conditions.
Yeah, so if we see a celebrity, an artist, a musician, a basketball player say, I live with depression or anxiety, and it's okay to talk about it, then I do believe other people in the community will feel like, okay, there's a reduction in stigma, and it can impact any one of us. We know that mental health, mental illness does not discriminate. So I do think it's helpful sometimes to see other people and be able to relate and say, all right, if they can come out and talk about it openly, so can I.
Do you find students are more empathetic by the end of this training, by this end of the 6-week training, that they get it a little bit more if somebody maybe is in a shell or is not maybe showing signs of joy and happiness, maybe just kind of walks with their head down? Do you think people get it a little bit more, and are they making any effort to try to reach out to those other kids?
Yeah, I do think students are getting it more. And some of that post evaluation information does say that, where students will say, now I'm more likely to reach out to a friend who's struggling. Or maybe on that pre-survey, they were undecided, not because of any reason, but they just weren't sure that they could do it. They didn't know what to say. But by the end of those 6 weeks, students are saying, I am more likely to reach out, or am I more likely to say something to somebody who seems quiet in the cafeteria or in the classroom? So yeah, I think that seeing that pre and post results, we're seeing some really positive things there.
I know the role playing is very big, and I
Mhm.
that was one of the things that I loved so much when I took mental health first aid with you, because you're actually in a scenario where you would what would you say? How would you
Yeah.
approach it? What would you do? So it's a good way to practice. But I also found it interesting to learn that there are people who've actually changed their course of their lives. They might have been contemplating suicide, or they just might have felt like a failure and were thinking about maybe dropping out of school, quitting their job, doing something that was so extreme because of their mental health condition. And somebody came up to them, or somebody said something to them. And that made all the difference. That amazes me.
Yeah, it's just sometimes that one caring person. And when we talk about mental health and reaching out, sometimes it is a total stranger. It may not be someone that you know. It could be a stranger that you just notice something in their eyes, or are having a conversation with somebody in the supermarket. You never know the impact you can make just by caring. And we talk about that in mental health, that every one of us can really, like you said, change the course of maybe how someone was feeling around their own mental health or their own mental health challenges.
You have to feel so good about the results you're seeing from this program. How many schools are involved in it now?
So right now in our project at the Mental Health Association, we have about 46 high schools in New Jersey, all across the state. And if there's a high school listening, or a parent or grandparent who's connected to a high school and they want to learn more about it, they absolutely can reach out to our organization and say, hey, I want to know more about teen mental health first aid. And we will definitely meet with them right away.
And where can they reach out to you, Jamie?
Our website is a great place to start, mhanj.org, and they can just look up mental health first aid and get connected to myself or our co-director, Ruth Kaluski.
Again, this is a free program. Why would a school not take advantage of it? Because there's so many things that we learn in the classroom. What could be more important than something like this? It could be life-saving for a student out there. But we also want to say that parents can get involved in this type of program. So talk to us a little bit about that.
Yeah, so there's other gatekeeper trainings for parents. Youth mental health first aid. There's also youth QPR, suicide prevention. So there's a lot of ways that parents and ordinary citizens that just want to know better and do better, look for warning signs, have the tools to open conversations, can take advantage of some of our other training. And again, if they look on our website, there's so many things that we offer. We're so focused on education, support, and advocacy at the Mental Health Association. And we want to provide that, especially during May, Mental Health Month, but all year long.
Yeah, absolutely. And I took both of those trainings. One was in person, one was virtual. So they're taught in various ways, and it's just so worth it. It's like learning CPR for your physical health, but it's
Yeah.
for your mental health, which I think we should all be trained in both of those,
Yeah.
because you never know when someone who is either a friend, a family member, someone you love, your child, or even a stranger might need your help. And this is a way to prepare for that. It does not take a lot of time. Generally, you can do this in what, a day, maybe two at the
Yeah,
most?
absolutely. A lot of them are one-day training. Some of the suicide prevention trainings are 90 minutes. So, depending on what time people have, and like you said, virtual or in person, there's a lot of impact we can make just around community education.
Absolutely. And before we go, I do want to say one more thing. It is okay to talk about suicide. We really need to say that in almost every time we do a chat together, that it is okay to ask someone about it.
Absolutely. We want people to ask those questions and open conversation with others.
That can make all the difference. Again, where can people reach out to you, Jamie?
MHANJ.org. Check out our website.
Thank you so much once again. Always good information. Jamie Angelini, Statewide Director of Suicide Prevention and Special Projects at the Mental Health Association in New Jersey. And you are living well with Robin Stoloff. Thanks so much for joining me. Hope you'll like and subscribe, and I'll keep you updated on my most recent episode. And thanks again for being here. Living Well with Robin Stoloff, empowering you to live a healthier life. I'll see you next time.